Today, I want to talk about metabolic syndrome and what it is and what we do. I run across a lot of people who are trying to lose weight or have high blood sugar issues or high blood pressure. So we're going to go through it, and hopefully you'll learn a lot more about it today than what you know right now. Okay. So metabolic syndrome is a cluster of conditions that increase the risk of heart disease, stroke, and type 2 diabetes. So you're going to have increased blood pressure, high blood sugar, excess body fat around the waist, and abnormal cholesterol or triglyceride levels. Okay. So next, we're going to go over, so how do you diagnose this? Okay. So you're going to diagnose it through abdominal obesity. So you got a big beer belly, high triglycerides, or low HDL, which is a good cholesterol. And then you're going to have three or four of these. The last one is high blood pressure. So a lot of patients come in, they are on high blood pressure medication and they have metabolic syndrome. Okay. Next thing is we're just going over a few of them. These are the things that you're going to have. You're going to have increased blood pressure, like we talked about, high blood sugar, excess body fat around the waist, abnormal cholesterol and triglycerides. You could also get like dark skin patches around your armpits or your neck, and you'll also get skin tags around your neck too. Blurred vision, increased thirst, urination, and fatigue. So when we're doing this, basically 1 in 3 adults in America have metabolic syndrome. Okay. So it's pretty prevalent. And one of the things you want to look at when you go to your doctor, these are the things you want to look at. You want to look at the glucose levels. We look at those right here. Now, we want them below 90. They're going to say 100. We want them below 90. Anywhere from 100 to 125 is considered metabolic syndrome, and then anything above 125 is considered diabetes. Hemoglobin A1c, same thing. They're going to say 5.6. We want it below 5.4. 5.6 to 6.4 is metabolic syndrome. Anything above 6.4 is diabetes. But the one we want to look at even further is the insulin. Most people never check the insulin levels. They're going to have a marker that is for diabetes, it's above 25 on the insulin levels. Metabolic syndrome would be anywhere from like 13 on up to 25. And then where we want it to be the sweet spot is here. This is where you need to be between 5 and 6. This person's at 4.2, they're perfect. That's optimal. Okay. So this is the one test. If you're going to get most people get this tested, the glucose levels and the hemoglobin A1c. And the hemoglobin A1c, that is a 90-day score of your sugar intake. So that's good to have. But this is the one we really want, a fasting insulin level. This is going to tell us a lot because if the insulin level's high, it's going to go high and then it's eventually going to run out. And when it runs out, guess what? The sugar is going to go out of control. We don't want to wait for the sugar to go out of control because then the insulin, you've depleted yourself of insulin at that point. When we look at genetics, these are the things we want to look. We want to look at these genes, these ATG genes. These are going to help us these are going to tell us we're going to have a problem with blood sugar, insulin, and hemoglobin A1c. So what I try to do is do genetics and do the blood testing so we can confirm it. And how do we control this? Reduce sugar intake, intermittent fasting, at least 12 to 15 hours. That's no snacking, and exercise. Okay. And there are some supplements we can talk about. And this is autophagy. So what is autophagy? Autophagy is a natural self-preservation mechanism in the body that involves the removal of damaged or dysfunctional cell parts. So basically, your cells get to take out the trash. That's what autophagy is. And that's why intermittent fasting works so well, is because it helps your body take out the trash. So here's what autophagy looks like. Basically, it gets to package up the cellular debris that's no good and spit it out and then recycle everything. Now, when you're doing that, everything is good. Okay. So what we're going to look at, it's going to lead to, if you can't do this process well, that's going to lead to type 2 diabetes, metabolic syndrome, then type 2 diabetes. But what's going to happen is if you don't do this well, the cell autophagy, what it's going to lead to is neurodegenerative diseases, aging, heart disease, developmental disorders if you're a child, type 2 diabetes, insulin resistance, fatty liver, and cancers. Okay, so what decreases this? What helps with cell autophagy? Intermittent fasting, exercise. That's why the ketogenic diet works so well. And that's why metformin and D-chiroinositol supplement works well. Okay, just so you know. Now, one of the most effective ways to induce autophagy is through intermittent fasting. Okay, we all know what fasting is. So, what's the longest fast anyone's ever done? So, we could go without eating one meal or two meals a day. The longest fast ever is 382 days, guys. So when I tell patients that they can go, skip a meal every now and then, they act like they can't. They act like they're going to die if they have to skip a meal or two. Look, this was medically supervised, but back in like what, 1973, this guy fasted. It was a medically supervised fast, but it was 382 days, and he was obese. So his body got in and started burning that fat. So for 382 days, his body utilized fat. He did not eat any food. Okay. So that's why fasting works so well. And that's why if you really want to lose fat, you have to get into your fat stores. And you cannot get into your fat stores if you eat sugar or you eat food, your body releases insulin. Okay. You cannot release insulin. If you release insulin, your body's going to store fat. So this is just kind of an idea where you want to start fasting. You want to at least get to 12 hours, and then that's intermittent fasting. So you're eating, 3 times a day, you're not snacking. This is going to be where to start. Then you get to 17 to 18 hours. This is where autophagy really starts cleaning up the cell. Now, when you get to 24 hours, that's when your gut starts to reset. Your gut starts to heal. When you get to 36 hours, that's when you really start burning fat. You get to 48 hours, that's when you start getting into ketones. That's when your brain really starts working. And then 72 hours is like a total reset. I've done a 72-hour fast, and I can tell you guys, you'll feel amazing afterwards if you do it. One of the supplements I would recommend doing while you're doing this, this helps with fasting. It's called Metabolic Stimulator Pro, and it has chromium pichlorate in it, inositol, D-chiroinositol, and myoinositol, which is good. It has phosphatidylserine and lithium. Now, here's what this does. It decreases the sugar and carbohydrate cravings, decreases fatigue, improved immune support, fewer memory issues, decreased weight gain, greater hormone regularity, and fewer hangry sensations, and a balanced blood sugar. So this is good for those people who are, on the border or trying to lose weight, or maybe on the border of metabolic syndrome and diabetes, or getting into metabolic syndrome. The key is, guys, you don't want to eat a bunch of sugar. You have to, if you fast, you eat whole foods. That's going to fix this problem. So anyway, I hope this information was helpful, guys. Just trying to bring it to you so you understand this, because I see a ton of people with metabolic syndrome, and metabolic syndrome leads to type 2 diabetes, and that is totally reversible if you do it. So the main thing is do a whole foods diet, and if you supplement with something like this and you do fasting, you won't have to worry about becoming a type 2 diabetic. Okay. All right. Thanks, guys. Have a good one.